Okay, so we're trying to look at what is known as a sphenoid bone. Looking at the anatomy of the sphenoid bone. So looking at a lot of bone here, but you could actually pinpoint this, which is known as a sphenoid bone. Okay. Looking at another image here, this yellow part matched to this yellow part is what is known as a sphenoid bone. So it's actually one of the most complex bones of the skull, and it's often described as having what a butterfly shape. Okay, this underneath picture will actually be a better view of that, So it forms part of the cranial base, and it contributes to the orbit and several important foramina for nerves and vessels. So it's located on the central portion of the skull base between the frontal and the temporal and the occipital bones. Shape is irregular, okay, but it actually looks like a bat or a butterfly, So what are the parts of these bones? It has a body, has a sella turcica. Don't worry, we'll make a special video to talk about the parts. It has greater wings, the bigger wings. Okay, you could say these ones. It has lesser wings. You could say these ones are the down. The pterygoid process, the optic canal, the superior orbital fissures, the foramen rotundum, foramen ovale, and foramen spinosum. Okay, so those are all the foramens you actually find on that bone. So articulations, in front, you say that is joining the frontal bone. This is the frontal bone. At the sides, you're joining the parietal bones. Okay, then temporal bones laterally also. Then because he has the greater wing and the lesser wing, then the ethmoid bone anteriorly. This is the ethmoid bone, like in front, literally. Then the zygomatic bone laterally, then the palatine bones inferiorly. So what's the use of this bone? Okay, what's the use of this bone? It forms a great part of the cranial base and the orbit. It houses the pituitary glands and the sella turcica. It provides passageways for critical cranial nerves and blood vessels. Okay. Serves as an anchor for muscles of mastication. So for you to be able to chew something, this must actually be there. So clinical notice, it could be affected by pituitary tumors, and if they are there, they often expand the sella turcica. Okay, and they're usually visible on imaging. Also, you could have fractures of the sphenoid. Okay, and because of so many nerves actually pass there, they could actually be affected. They could also have the sphenoid sinusitis.